amazing how reliable data, political will, and cultural icons can drive progress. Together, they create a powerful synergy, enabling effective strategies and garnering broad support for sustainable development and equal opportunities for all. But why am I telling you this? Well, today's guest has seen the synergy work, and he is here to tell us how their nonprofit, the Access Challenge, is transforming equity in East and South Africa. Our guest is Asad Lilani, and he has worked directly with the former President of Tanzania, His Excellency Jakaya Kikwete, and he has expertise in emerging markets, business strategy, sustainable investing, high-level presidential research, presidential book writing, government affairs, diplomacy, and policy planning. Welcome to Chezuba Talks, Asad.
Thank you so much, Tej. It's great to be here and great to be in conversation with you.
Wonderful. Let's get started. So, Asad, healthcare, safe drinking water, and education are the pillars of any community, any development. Please tell us how your organization got started in achieving this impressive feat.
So the Access Challenge has been around for almost 20 years now, really trying to help to increase access, to healthcare in Africa. We started out because there were too many children, most specifically in the global South, who were dying of diseases and the health challenges that could be prevented by things like vaccine, like the health education and better access to, health services. We have conducted campaigns in major areas such as malaria, HIV and AIDS, cholera, polio, and others. So in malaria, for example, I'm from Tanzania, and I remember growing up, 70 to 80% of the time, when any of us went to the hospital because of a fever, we were told it was most probably because we had malaria. Malaria was so rampant, it was a given that every child is going to go through this challenge. The only question for us was who is going to survive and who is not going to survive. And at that time, the Access Challenge, ran like a malaria campaign in Tanzania, where we distributed bed nets all across the country, but also created a big malaria champions program to get every trusted voice in the country, from the president to the biggest soccer star, to the biggest journalist and the media personalities, to encourage people to use a bed net. And it was this combination of not only making it easier for people to access the bed net, but to create platforms for the health education needed so that when the bed nets actually go to people's houses and people's hands, they would actually use it. So our campaigns are a combination of access and education. And I would say we're obsessed with not only making things like vaccine accessible, but also ensuring that when they are accessible, people are actually willing to take it. So one does not work without the other.
Absolutely right. So one is definitely dependent on the other. So how many programs are you running currently, and what is your target?
Sure. So we currently, have three major campaigns running. So one is based on, the universal health coverage. One is based on the routine vaccinations, such as polio, HPV, cholera, COVID-19 and others. And the last one, is based on HIV and AIDS. On the campaign on the universal health coverage, our campaign was started in 2018, with the DG of WHO, the former president of Tanzania, and our CEO at that time, Kate Campana, where the goal of the campaign was to support the most important of the global goals for the United Nations, the WHO, and the African Union and the Africa CDC to achieve universal health access all over the world by 2030. And we are supporting that goal for the African continent. So on this specific campaign, we conduct high-level convenings at the world's biggest health meetings, such as the UN General Assembly, like the African Union Summit and the World Health Assembly in Geneva as an example. Here we bring in the biggest experts on the healthcare field in Africa in one room to discuss the progress being made in the past year, where we are today, and what steps do we need to take to catalyze our efforts to achieve this goal by 2030. And by experts, we mean from policymakers to youth groups to civil society to the private sector. We believe that if we, want to have the slightest chance to achieve this big, bold global goal, it's extremely important to evaluate the progress every single year, to bring the experts in a room, and to come up with new ideas and tweak the details to ensure that we can catalyze our efforts to ensure we're moving towards the direction to be able to achieve our goals by 2030. The second campaign is we have the campaign on routine vaccinations. On this one, we run a big mass media campaign to drive demand on vaccinations and to try and educate the people to make the right choice. There's a lot of vaccine hesitancy in the world. Most recently we've seen with COVID-19. We partner with trusted sources such as the influencers of the country from all spaces, and we use platforms such as social media, like radio. We have vaccine roadshows. We like to call our approach on this side called the surround sound approach. So we can reach every single person as to where they are through the medium that they prefer, and to ensure that we can get them the vaccines that they need and we can save more lives. The last campaign is on the campaign on HIV and AIDS. And this campaign is purely a youth empowerment project. We look for youth groups in the continent of Africa and we empower them to make their ideas, that they think will be applicable for their communities. We make them come to light. We bring the resources and we bring the global expertise to ensure that their ideas come to life. And then we take those ideas and try and bring them to the global stage to inspire more change in countries around them as well. So these are the three campaigns that we have currently running. Our goal
Absolutely.
right now is to double our campaigns engagement. Currently we do 1 to 2 campaigns a year, reaching an average of 50 million people a year. And our goal is to double that by doing 3 to 4 campaigns a year to get to 100 million people a year and to be able to save more lives. And I'm, so happy to even say that we have already built 3 country teams, in the East and like Southern Africa. And now we're in the progress of talking to a few potential partners to see how we can create these additional campaigns and grow into additional countries to be able to save the next generation.
Wonderful. That's inspiring indeed. Uh, on such a large scale, when you are getting resources, when you're getting people, and talking about the surround sound methodology, I'm sure you face a number of challenges. What are the challenges that you're facing, and how do you overcome them? And as a subsidiary to that question, what kind of support do you seek?
Great. I think that's a great question. And I think, to be honest, challenges are many. And I would say working on the African continent, the challenges are even higher. Um, and I think because the need is higher, the challenges always become higher as well. I'll talk about a couple of the challenges. Number one is siloed approaches. Um, this is a bigger issue that I've personally seen is a lot of organizations and partners are working on specific disease areas and not trying to leverage one campaign, for example, to address more than one disease. If you look at a specific burden, for example, something like malaria or something like
Mhm.
HIV, there is a
Mhm.
lot of money and campaigns going in those specific areas. But if you look at something like pneumonia, if you look at something like the HPV vaccine, there isn't that many resources going in. And we as a campaign believe that, there's so many deaths happening in Africa that we can't be using a single approach and wait for the next resource to come in to tackle the next approach. So what we are trying, to solve, and the challenge that we're facing is, we we're trying to encourage partners to use the campaigns, for example, on something like HIV. If there's a campaign on HIV going on, how can we leverage that campaign to also push for some other routine vaccinations? So number one, I see is there's a lot of siloed approaches, and we are trying to ensure that one campaign for one specific disease does not only target that one disease. How can we create campaigns that could strengthen the health system as a whole, but at the very least, how can we ensure that one campaign on HIV can also at least set up the foundation or move a bit on the other disease areas? So for example, we have a campaign in Malawi currently running, and specifically we got funded to do like the routine vaccinations. However, we sat down with the partner, we sat down with the government, and we said, listen, how can we create a campaign that not only focuses on one routine vaccination, but let's focus on, we found out that their COVID-19 vaccination numbers were very low, so we're targeting that. We're also targeting the HPV vaccine for girls because the number was low. And then number three, we're also targeting like the HIV space. This is one campaign, but the messages and the activities are tweaked so that we can ensure that we can address three areas using the funding for one area. So that's number one, to ensure that we go out of the siloed approaches. And I think that will be the biggest win if we are able to. Second, I would say, is the misinformation and the vaccine hesitancy. Social media is the biggest cause of that today, to be completely honest. That's why the health education is even more key today than it was, say, 20 years ago. It's not just critical to ensure people have access to the health services, it is also important that when they do have the access, they actually use them. If they have a vaccine available, they can actually take them. So the second issue, that I see is a lot of partners are focused on access, but not reaching the last mile. When vaccines are made available, how can we ensure that they're actually going into people's arms? And we see that as a big challenge, and that's why we have tweaked our campaign, not only to focus on access, but to ensure that there is a follow-through plan where the vaccines are not only made accessible, but are actually going into people's arms. And the last thing that I will say is, reaching the mile is not easy. Like equal access to us means no one is left behind. Equal access for us means reaching the last mile, even if it's the hardest thing to do. And I'll give you an example of one of our campaigns now, and I'll use the same example of Malawi. We're currently conducting a routine vaccination campaign in Malawi, like I mentioned, in two specific districts called Tiolo and Falombe. We picked these districts because they had the lowest vaccination number, their vaccine hesitancy was the highest, and they were the hardest to reach. And this made the campaign extremely hard. It would have been very easy for us to go to the main cities where the other partners are going and where most partners have been doing campaigns because it's easier. We did the opposite. We looked for districts that had no partner going on. We looked for districts that needed our support the most. And by picking the hard to reach districts where the vaccinations were low and the vaccine hesitancy was high, what happened as a result of that, like our task becomes two times harder, two times more expensive. It takes two times more the work. And I think in this aspect, the challenge that, I see is a lot of partners are focused on the easy way out, on going to the main cities. And I think I just want to make a call to action for partners to go through the hard road, because the people that really need our help are the people where there's no partners and, there's no health education. And sure, it's expensive, but let's not forget about the people that, are the most, of course, most marginalized. And then you asked me the question about the resources that would be most beneficial for scaling our efforts globally. Like I mentioned, one of our goals, is to reach about 10 million girls in the next 2 years to get the HPV vaccine. The HPV vaccine is one of the most effective, non-political, and non-controversial vaccines out there. To ensure that girls in Africa get the HPV vaccine while they are young will help bring down the cervical cancer cases in girls and women by 90%. And we have a very clear issue, a very clear goal to address it. And, of course, lastly, the most importantly, we have a proven methodology based on data to solve this issue. Coming to your question, now all we're looking for is for visionary partners, strategic partners. We're not looking just for partners to come and fund our campaigns. We're looking for partners who have an interest to change how global health works. We're looking for partners who have a vision to ensure that every girl, every young person has access to life-saving information. We're looking for partners who want to go down in the history books as leaders who had the courage to invest in creative ideas, new ideas, to invest in young leaders like myself who have had the courage to believe that I think if we do things differently, we may be able to get something. If we change the way that the global health world has been doing campaigns, we might have a shot this time to achieve our global goals. So, to keep it in a nutshell, I think we're looking for partners who have a vision to completely change the way that things have been doing. And second, to really change history in how global health works.
Wonderful. Very, very inspiring, and good to see that you are taking the hard way and not taking the easy way out. It is a challenge, and I think you've taken the challenge head on. Kudos to all of you at the Access Challenge. Lastly, could you share your website and the social handles for us here on the podcast? And maybe people can visit your website and find out more.
Sure. Yeah, please do visit, our Facebook, our Instagram, our website. So the website is pretty much like the accesschallenge.org, and the Twitter and the Instagram is just at the Access Challenge. And we also have the campaigns itself that we're running. Like our campaigns, all of them have been tied by one name. It's called One by One. If you just search for One by One, you'll find all of our campaigns. And our goal is
Right.
tied to the name. Our goal is to achieve the results that we want in the whole continent
One
of
by
Africa, one by one.
Absolutely. Fantastic. Well, thank you, Asad, for sharing those valuable insights on the Access Challenge. Your expertise and perspective have provided us with a deeper understanding of the efforts and strategies needed to promote universal healthcare in remote places. Thank you very much.
Thank you for having me.